Heavy centralization of HIV care in urban areas, poor community-based care, unemployment, coupled with stigma, are the major constraints on proper and inclusive HIV care service accessibility for people living with disabilities. According to a report from Tunaweza Foundation, this has escalated high prevalence of HIV cases to PwDS. Now a one project, enhancing the PwDS HIV response perspectives, has been launched in Kawempe, Kampala, as Victor Narule, the Executive Director, Tunaweza expounds.
The PEPFAR project on access for people living with disability, so that we can see the services on people with disability, that people with disability can access the information on HIV, they can access the services on HIV.
The Country Coordinator of PEPFAR at the US Mission, Mary Borgman, applauds Uganda in the fight against the spread of HIV/AIDS, but reiterated more efforts is needed to increase awareness specifically to people with disabilities.
We need to redouble efforts to address HIV prevention and treatment. And that means we need groups like Tunaweza to make a greater impact while working with people with disabilities. PEPFAR continues to be committed to ensuring that all groups in need of HIV prevention care and treatment services receive equitable health services free of stigma and discrimination.
The Member of Parliament for Women with Disabilities, Laura Kanushu Opori, witnessed the launch.
The challenge we have is the implementation, and we want to tell the enforcers of the laws that you're not doing your job. But also I want to say that people have a thinking that people with disabilities are not sexually active and therefore they will not be affected by HIV and AIDS. That's a myth, and therefore that's why we need to focus the awareness raising.
The project is funded by PEPFAR Small Grants and US Mission in Kampala, targeting 150 beneficiaries in Kawempe Division who will access comprehensive, suitable HIV-related services. Abraham Bwaita compiled this report.